Hello, Dr. Joseph Cipriano with Lumiere Cosmetic Vein Center, presenting today vein treatment questions. Lots of questions I get asked that I'm hoping to help alleviate some of the concern and worries. You'll see some redundancies here, but they're repetitive in nature, necessity. First ones, they've had treatments before, nothing got better. What can they do? We always center and focus on conservative measures, and we'll go into detail about this later. But conservative measures are necessary to help build an understanding of what we're trying to accomplish. Not only by what you're trying to do without surgery, but also if we were to ever do a procedure, this helps reinforce the procedure, making it so that there's less pain and quicker recovery and conversion to normal functioning legs quicker. Persistent disease. Patients have had treatment, but the GSV is treated. But you can imagine if there's another vessel distally that communicates with the varicose vein that goes around that and goes to an accessory vein. These are all going around our treatment. So the doctor could have done a perfect treatment, but without continued follow-up and follow through for treatment, there will be no improvement of pressure. So therefore, the patients won't see any improvement. So, and there's emergencies that happen. There's delays in continued treatment, and a lot of things take precedent. People have heart failure, lung issues, family issues or emergencies, travel issues, or needs to get somewhere else. Obviously, this takes a back seat. But for completeness sake, there has to be follow through to make sure that disease is adequately controlled and eliminated. Additional disease processes can make things persistent and difficult to treat. Things that put pressure against the venous column back into the legs, heart failure, liver failure, kidney failure, lungs can have an issue. Obviously, anything that's putting pressure again on that column of blood. Children, babies, pregnancy obviously can cause this. They've had treatments before. Their symptoms actually got worse and didn't improve. This I get asked actually a lot as well, and this follows into suit for what we just spoke about. I always start in prevention, and conservative measures. We do talk about additional venous disease that needs to be treated because if it's not completely wrangled, this actually can get worse rather than better. And this does feed into the fact that we do talk about genetics here later, but there are genetic components that make things easier to get bad quicker. That does coincide with heart failure, liver failure, kidney failure, or concomitant medical diseases that put pressure against that venous column, pushing blood down our legs. They've had treatments before, their symptoms got better, and now it's 4, 6, 7, 8, 10, 12 years later, and the disease is back again, and they're identifying it as venous disease again. Again, focusing again on prevention, compression, and conservative measures. Genetic predisposition. Some people are just prone to having this disease happen because their valves are weaker. They're more prone to it because their valves and the veins aren't used to holding on to the amount of blood that's pushing down. If a patient weighs 300 pounds or they're 8 foot tall, that column of pressure is actually higher or stronger than somebody that's 4 foot 11, 110 pounds. So it is worse and can be more difficult to control in those that are heavier and bigger. Additional medical diseases, as I've already lit upon, we talk about heart, liver, kidney, and lung disease, and any concomitant medical disease that again is putting pressure against that venous column. So going into a little bit more detail, venous conservative measures. Active disease, we need to do conservative measures. This is compression to the level of the disease, so not just to the knee, but up to the level of the thigh or even all the way up under our abdomen. This needs to be maintained if possible 12 hours a day. The caveat to this is you can't have arterial disease of significance because obviously we don't want to be compressing on that leg, making it hard for blood to get in. If we can't help blood get out if we're making it difficult for blood to get in. So it's making sure that we're looking at the whole picture, not saying single dimensions. Us as physicians need to make sure we're working not just outside the box, but trying to think of what's coming at these patients from all angles. Elevation of the legs at rest, obviously, just like gutters on a house, 1/8 of an inch over 10 feet, it makes it so that water runs downhill. So as long as we get those legs up, it's helping aid in removal of blood from the legs. So while they're resting, they can't fall asleep in their chairs with their legs down. They need to get their legs up. Exercise, if possible, with compression will actually help not just prevent injury, but help with recovery and actually help with performance. And will help move the blood up and out of our legs. But any exercise that will take, because it won't just help venous insufficiency, but also other medical issues. Hydration. I bring this up because you can't just be talking about the roads. You need to be thinking about the vehicles on the roads. And there's so many different things that makes blood move easier. One of the basic ones is hydration. Why? Because then it helps with viscosity, inversely related to the adequate hydration of the patient. Compression stockings and prevention. We talk about venous insufficiency and conservative measures for active disease, but I like to focus a little bit on prevention because I don't think it's addressed nearly enough. We've got lots of patients that have had treatment, but we're doomed to have recurrence of disease if they don't take steps to help prevent recurrence. So what does that include? That includes doing at least compression stockings in these situations, any and every time you fly, because blood gets pulled out your legs and pushed down. Anytime you're going up in an airplane and traveling for long periods of time, not moving. Your legs are dependent and not moving. So you need to wear compression stockings every time you fly. Same rule applies partially when you're driving. Obviously, you're not decompressing in a cabin, but still same idea. If you're sitting in a car and driving 2, 3, 4, 6, 8, 10, 12 hours, you need to be wearing compression stockings. You need to hydrate. Again, talking about hydration and reversing that viscosity ratio. Elevate your legs when possible. Compression stockings, compression stockings, compression stockings. Adoption of active disease treatment strategies when possible. Final tips and takeaways. Sorry. With any symptoms, see your vein specialist as soon as possible. The earlier you intervene, the easier the treatment. Just like with any hernia, easier to treat when it's a half a centimeter versus 10 centimeters. All treatment is to move patients from active disease to prevention. No patient with legs is immune to recurrence, meaning any and every patient we see has risk of recurrence. Those that don't have disease, we can educate and talk to them that are there with their family members and say, hey, if you adopt some of these strategies, maybe you won't be here where mom and dad are. Try to look into the future and hope to try and avoid this. Recognize as your legs get smaller, improve, or your socks get older a year later, you need to get new socks. You can't just use the same socks year after year after year after year. Treatment's a learning process, not only for you, but also for your specialist. We are learning about you and the pressure differential, so it's important that we talk and we see each other regularly. I say this to every patient. You're the captain of the ship. I'm your first mate. I educate you and tell me how you want to drive it. Treatment's only as fast as you're comfortable with. There's lots of things that can happen. We may start with a part and we have to put things on hold because something comes up. There's emergencies each and every day, and we talk and walk our patients through this all the time. But it's important that you stay in tune with this being a problem. As people start to tune into their legs and their veins being a problem, they start taking steps. They start to realize, hey, my legs don't have to feel like that. They don't have to be tired. They don't have to be heavy. I can walk longer distances when I take time and pay attention to my legs and treat them the way that they need to be treated. So we get the pressure of the blood off of the skin and actually make it so the blood can circulate again. The worse the vein, the worse the pain. I'm sorry you can't see that because it's behind my video here, but that specifically tails into a lot of this. So again, the longer we wait, the worse this gets, and it's harder to treat. Dr. Cipriano with Lumiere Cosmetic Vein Center. Please call us if you got any questions and come see us. More than happy to spend time to talk to each and every patient, give them all the time I can. Take care. See you soon. Look better, feel better with Lumiere.